Hey there, have you ever wondered why some people keep on getting dental caries even if they brush their teeth daily and some people are free of it? They don't get dental caries even if they have their food of any kind. Let's talk about the science behind the dental cavities. We'll talk about what is the dental caries, why it happens, and how you can stop it in their track. Let's talk about dental caries. Dental caries, the cavities, they are scientifically called dental caries. These dental caries are the permanent tiny holes in your enamel which spreads to the dentine, the second layer of the tooth, and then goes below this to the nerve and gives you pain. So, what makes them happen? There are some bacteria. Your mouth is full of bacteria, millions of bacteria. Some of them are good, some of them are bad. They produce acids by feeding them on the food left over and the particles left over in your mouth, producing acid, and that acids reduces the strength of your enamel where the cavity starts forming and bacteria gets accumulated on those points. That's the first point where you get cavities. Do you think just the sugar is the main culprit? No. It's the any kind of carbohydrate which is getting stick on the teeth, on your tooth. Do you think sugar is the main villain? No, it's one of the villains. Other villains what you keep on having in your mouth are the food which gets stuck on your tooth. They remain on the tooth surface to be partied by the bacteria. They are your bread, cheese, sticky caramels, all those things. They degenerate to form the carbohydrate. They are the form of carbohydrate. Those carbohydrates they degenerate to glucose, and this is the feed for your bacteria, which in turn forms the acid. So, how to prevent them? So, before I talk about the cause and the effect, let me talk about the stages of dental caries, dental bacteria, what they do. First thing is erosion of the enamel, early white spots on the teeth. They are the spots where your enamel is getting deteriorated because of the acid, but it is reversible by the fluoride toothpaste. Second stage, it makes a small burrow in your enamel. That is again preventable. No pain in this point. Third, it spreads to the dentine, the second layer of the tooth. That is a soft area. It gives you sensitivity, but it is again reversible. It goes down, touches your pulp. Your pulp starts getting the on-off pain. It is again treated. Last stage, the fifth stage, is that bacteria goes beyond your tooth and the pulp, affecting the surrounding structure, making the abscess or the cyst. That's where you start losing upon your tooth. So, always think, if you are getting something stuck in your mouth, get it treated. There is a cavity. It's not the pain which indicates the dental decay. Now we have understood the stages of decay. Let's talk about how to prevent them. First thing, brush twice daily. Second, floss your teeth. It stops food getting stuck between your teeth. Third, increase water intake. Rinse your mouth again and again. Don't let food getting stuck in your mouth. The fourth, stop using sugary and acidic diet. Reduce upon them. Don't let them be in your mouth for longer. Next part, use sugar-free chewing gums to cleanse your tooth surface and the unavoidable areas where food are getting stuck. Next, visit your dentist daily. No, visit your dentist regularly every 6 months. Yes, we can spot it in the early stage and get rid of it. Don't wait for pain to be telling you now you need to go to the dentist. Just make it a habit. Now we have understood the cavities, so let's bust some myths. First, if your tooth doesn't hurt, I don't have cavity. False. Cavities don't give you pain until the last stage. It can be detected and taken care in the early stage. First. Second, brushing hard cleans better teeth better. No. It erodes the enamel, gives the bacteria more surface to settle on them. Don't do hard brushing. Third, mouthwash can replace flossing. Mouthwash is just a astringent, a flavoring agent which gives you a better breathing, but not the tendency to reduce the plaque on it. Now we have understood what is the caries, what happens and how it happens. Let's talk about some of the myths. First thing, if I don't have pain, I don't have cavity. Please don't get into that. Your decay won't tell you till it has reached the pulp that I am there. Early detection of caries are done by dentists, and your detection is food getting lost between the teeth. Early caries is not going to give you pain. First. Second, if I brush hard, I hardly get cavities. Don't do that. Your hard brushing is going to erode your enamel and expose the dentin, which is again going to be prone for more of the cavities. Don't do that. Third, water floss is better than the brushing. No, water floss is only used when enormous space is there in the spatial areas, not in routine. Next, mouthwash can replace flossing. No, mouthwash is just an agent which gives you fresh breathing, but it doesn't have a capacity to remove the plaque between your teeth. It has to be done by flossing only. If you have some more of these kind of myths in your mind, just make a comment on the screen or ask us on our channel. We'll be happy to reply. And now concluding to the science of cavities. Now that we know what causes them, how can we prevent them, and how can we get rid of the black teeth and painful tooth in your mouth. Visit Dentalquest for more of these caries related queries in your life, and we'll be happy to help you. If you found this video very helpful, please subscribe and comment on it. And what's your favorite next hygiene topic? Please write in the comment. We'll be happy to take it up. Thank you. See you soon. Wish you a cavity-free smile from Dentalquest.